Hello, I'm Dr. Russell Barkley, and I'm a clinical professor of psychiatry at the Virginia Commonwealth University Medical Center in Richmond, Virginia, here in the United States. In this lecture, I want to explain to parents the nature of defiance in teenagers. I want to talk a bit about its nature, to some extent its causes. It's very important that parents understand that, but mostly about its management. If you wish further information about my books on defiant children, defiant teens, or ADHD in children and adults, you can visit my websites here. First, we need to distinguish between different kinds of noncompliance or disagreement between parents and teens. Parents need to understand that it's quite natural for teens to disagree from time to time with their parents. After all, teens are growing up. They are beginning to separate from their parents. They're beginning to develop a sense of autonomy or independence, and that leads them to want to have more of a say or influence over the decisions that are being made about their life. It also means that they're spending more and more time away from home and in the company of peers, which is only natural, of course, since those are the people with whom they will have to cooperate and compete in their adult life. So some disagreement is not unusual and is to be expected and indeed welcomed because it shows a certain level of maturity in the teen as they begin to want to take over more of the control or decision making in their life. Sometimes, however, teens may fail to comply with a parent's request. This is not active disobedience, it's simply passive non-compliance with a directive, a rule, or an instruction. Again, this is common and often results from the teen being distracted or inattentive, or simply mind-wandering or daydreaming and not being fully attentive to what the parent has instructed them to do. Again, this is not a serious problem. It happens a great deal of the time in children and teens, and we would not view this as something clinically significant enough to warrant either a diagnosis of some sort or intervention. However, there is a point where disagreement or noncompliance reaches a level of severity that it becomes more oppositional and defiant behavior. In this case, defiance refers to the active refusal to obey a parent and overall resistance to parental authority. This refusal or resistance can be verbal, it certainly can be emotional, and sometimes may even be physical to the extent that there may be some physical contact between teen and parent or even outright aggression. If this pattern of defiance goes on long enough, it can escalate very quickly to include not just anger and hostility between the parties, but temper tantrums or outbursts, in the case of children, breath-holding spells, but in the case of teenagers or young adults, possibly even destruction of property or aggression against the parent. This pattern of behavior is not common in teenagers and often signifies the presence of some sort of psychiatric disorder. Defiance is associated with several of them, including ADHD, bipolar disorder, disruptive mood dysregulation disorder, borderline personality disorder, and certainly more general antisocial behavior and conduct disorder. This kind of behavior certainly will warrant not only a diagnosis, but intervention to try to help improve the parent-teen relationship, but especially to improve the teen's overall developmental outcome. Because without treatment, the outcomes of this kind of defiant teen are not particularly positive. Indeed, they experience a variety of adverse consequences. So why should we treat defiance in a teenager? Well, to the extent that it goes beyond mere disagreement and discussion, or passive, inattentive noncompliance, to the extent that it involves hostility, anger, temper outbursts, yelling, conflicts, and even aggression, it needs to be treated because it will escalate further to become a more general pattern of social behavior between the teen and others, particularly authority outside of the family, not just in the family. Also, this kind of conflict between parents and teens is a very common reason why teens are often referred to mental health centers for diagnosis and treatment. And that is because it happens tens, if not hundreds of times a week, and is a great source of distress for the family and probably even the teen as well. As I've mentioned, this pattern of active defiance and disobedience is correlated with a number of future problems, but especially with future risk of delinquency. That is, of antisocial activities not only in but outside the home that may be comprised of lying, stealing, truancy from school, curfew violations, even running away from home without parental consent, and in the community, drug experimentation or even drug use. Because you see, over time, defiant teens, because they are often being rejected by their more pro-social peers, come to associate with other teens who are in trouble. Teens that we refer to as a deviant peer group because they model antisocial or other negative and unwanted social behavior. So it's very important that we do something about this problem in parent-teen conflict and teen defiance. As I said, we need to treat it as well because it's a major source of distress within the family, often leading to problems with siblings, to marital difficulties, sometimes even to difficulties with employment, since parents have to take more time off work to deal with the disruptive behavior of the teen, both at home and within the community, and sometimes even to protect younger siblings from the distress or even aggression that the defiant teen may be engaging in. So it's a very frequent pattern of behavior leading to great distress and often predictive of much worse outcomes for the teen. We also know that when defiance starts in childhood and persists into adolescence, it may begin with one or both parents, but it often progresses to involve defiance toward teachers in the school situation, and even defiance of adults and other authorities in the community, such as disobeying laws and even refusing to cooperate with police. So there is an expansion of this hostile, defiant, and oppositional behavior outside the home to encompass the larger community. And when it gets to this extent, it often interferes with the teen's development of appropriate independence, self-care, and general adaptive functioning. Because defiance makes the teen unavailable for learning, which is to say also unavailable for being socialized into society as a contributing, constructive, and cooperative member of that society. So we want to make sure then that we do not dismiss this level of defiance as simply being part of normal or typical variation in teen behavior in the population. It isn't, and it demands immediate professional attention. This slide shows a number of the adverse consequences for the teen if this pattern of parent-teen conflict is not diminished or resolved. We have both the parent engaging in high rates of emotional and hostile behavior, often referred to as disrupted parenting or emotional coercion. And of course, we have the defiant child or teen engaging in very similar patterns of behavior toward their parent. And should this go on for a sufficient period of time, which it often will, it leads not only to a very aversive or unpleasant family environment, but often to isolation of the teen within the family, which is to say that few family members wish to spend much of their leisure time with someone so unpleasant and oppositional. But it may also lead to the family being isolated further within their community, since neighbors or other families, including relatives, may begin to reduce the time they spend with this particular family because it is, again, unpleasant or aversive. We often find that there is a reduction in shared activities among other family members as well. And as I've already mentioned, the teen or the child is likely to be rejected by their peer group because of their high rate of emotional behavior, defiance, aggression, and so on. As I mentioned, this can lead to impaired adolescent socialization into our community and the rules of our culture, and it frequently results in very poor academic performance and even reduced school attendance due to truancy when the teen becomes this defiant. This may lead the teen to leave school before completing compulsory education, or even being kicked out of school, such as in school suspensions or outright expulsion, because of their antisocial behavior in that environment. Over time, both the teen and the parent begin to experience demoralization, maybe even some depression, low self-esteem, and a sense that they are not particularly competent in dealing with the other people in their family. If it goes on long enough, teens may even develop a sense of paranoia, or better yet, they may develop a cognitive bias in which they believe that others are acting toward them with malicious intent. Even though that is not true when it comes to their interactions outside the family, it may well be true within the family, because sometimes these conflicts or coercive exchanges are intentional. Once that decision or that cognitive bias develops in which the individual perceives others as engaging in maliciousness toward them, it can lead to the initiation of aggression toward other people, even unprovoked aggression, because the teen perceives that their aggression is justified by the maliciousness of other people, when that is a delusion. It is not true, and yet we may see teens engaging in unprovoked aggression, particularly toward peers. Now, when it gets to this level of defiance, this level of severity of parent-teen conflict, the teen may qualify for a diagnosis of oppositional defiant disorder, or ODD. The diagnosis of ODD requires that the teen have at least 4 out of the 8 symptoms that you see here, including often loses temper, often argues with adults, often actively defies or refuses adult requests, often deliberately does things that annoy other people, often blames others for their own mistakes and misbehavior. It's often seen by others as irritable, touchy, easily annoyed by even minor things that other people might be doing. And of course, the teen frequently displays anger and hostility toward others, as well as resentment toward them. Finally, some teens develop a pattern of spitefulness or vindictive behavior, as I mentioned, because they see the actions of others as out to get them, malicious, intentionally trying to harm them. These 8 symptoms can be thought of as forming 2 dimensions of emotional and social dysregulation. The first one, the emotional one, is comprised of the temper, irritability, being easily annoyed by others, and of course the anger. The second is a social component in which the teen is engaged in defiance against another and refusal to obey. And this is where the arguments, the spitefulness, and the vindictiveness may come in. The reason we distinguish between these 2 dimensions of behavior is that they arise from 2 different sources, and they also predict different problems over the development of the teen into late adolescence and young adult years. We find that the emotional dimension of ODD is predictive of later risk for depression, anxiety, or other emotional difficulties. This dimension, the emotional dimension, often arises from psychiatric problems or psychological difficulties within the teen themselves. In other words, there is something about the teen's personality and psychological makeup that leads them to be more emotionally unregulated, quicker to anger or display emotion of all sorts, and have more difficulty down-regulating or controlling their emotions once they have been provoked. The social dimension of oppositional disorder arises from learning within family interactions with others how to use those emotions to manipulate and coerce other people into doing what they want them to do. That is what the teen wishes. Usually that involves being left alone. It involves trying to escape from responsibilities or other unwanted or unpleasant tasks that all teens are asked to do and may not wish to do, but need to do in order to participate in the family, contribute to their family's well-being and their own, and as I've said, become socialized into our community. So that social dimension of ODD often arises from early training within the family, in which at least part of the time the use of high levels of anger and other negative emotions succeeds in driving other people away and the teen being left to do what they wish to do without complying with parental rules and requests. Over time, the social dimension of oppositional disorder is predictive of later conduct disorder, delinquency, or other antisocial behavior in the community, drug experimentation and use, possibly antisocial personality by adulthood, and an increased risk of criminal behavior in adulthood. So, both of these dimensions arise from different sources and predict different adverse consequences over time. By the time a teen reaches adolescence with their defiant behavior intact, it often means that there is another psychological or psychiatric disorder that has linked up or is comorbid with the oppositional disorder. The reason for that is that early defiant behavior among preschoolers is not uncommon and often is simply the result of parents needing to readjust their child management skills in order to encourage the child to be more cooperative. When parents do that, we see that defiant behavior often goes away. Indeed, defiant children often show remission of their defiance. 50% of them, in fact, about every 2 years, if all they have is defiant behavior. But the longer defiance goes on in the life of a child, and particularly when it persists into adolescence, it is usually associated with another psychiatric disorder or developmental or learning problem. Indeed, by the time someone reaches 8 to 10 years of age and remains defiant toward their parents, over 80% of them will have a second psychiatric disorder, and perhaps more than 50% of them may have a third. The most common disorder that goes with oppositional disorder in adolescence is ADHD, or Attention Deficit Hyperactivity Disorder. You can see other lectures that I have created on that topic. But notice that the overlap of ODD with ADHD increases with age, such that in young children it's about 40% risk. But by late childhood, as I've said, the risk that ADHD is present in a defiant child or teen is 80% or higher. Now we know that ADHD is a neurodevelopmental, largely biological disorder that is going to require separate treatment, often medication, in addition to what we will do to try to address the teen's defiance. Another problem we see with adolescents who are defiant is that by then they usually have developed a pattern of antisocial behavior in and outside their home. I've mentioned these such as truancy from school, violating parent curfews, lying, stealing, fighting, confronting victims, breaking and entering into other people's property along with theft, and also substance use and abuse. So conduct disorder is a serious problem, and over half of teens who have oppositional disorder often also have conduct disorder. They even, in fact, have already had contact with the police or other authorities because of their antisocial behavior. I've mentioned already that defiant teens are typically doing poorly at school as well, and may even leave school early without completion. That leaves them far less educated than their typical teenage peers, and that is going to restrict greatly the occupational opportunities that might be available to them later in life in order to earn a living. It's no surprise that defiant teens have very poor social interaction skills with others, particularly other teens, and that's because their defiance has kept them from learning pro-social, appropriate, cooperative social skills that are needed to make and keep friends with other well-adjusted and pro-social teenagers. Sometimes we see that the defiant teen may also have developed post-traumatic stress disorder. Such teens put themselves in harm's way much more than do other teens, usually through fighting or aggression, or through being bullied by others, or even physically aggressed against by others because of their disruptive behavior. And of course, when that happens, about 20% of teens who have been exposed to a physical or emotional trauma are more likely then to develop PTSD, or post-traumatic stress disorder. I've mentioned that as defiant behavior continues through adolescence, it is linked to depression, demoralization, or what we think of as dysthymia, a milder form of major depression. But it can also be linked to a more severe mood disorder. One of those is bipolar disorder, manic depression, in which teens may be defiant, particularly during their either manic or severely depressed episodes of their disorder. Another more newly identified disorder of mood is disruptive mood dysregulation disorder, in which not only is the teen depressed, they are highly irritable or brittle in their mood, are often prone to severe temper outbursts that may even include violent or destructive behavior, usually with little, if any, provocation. That is also a mood disorder and highly predictive of major depression as well as antisocial behavior over time. Finally, defiant teens, as I've said, are at higher risk for drug experimentation and substance use or abuse. And that is again because they are hanging around with other inappropriate, deviant teens who themselves may also be using substances and therefore give this teen more access to such substances. The predictors of when a teen is likely to move from oppositional disorder to also having conduct disorder seems to be predicted by the presence of these other factors in their life. The teen often is poorly supervised by their parents, both in and outside the home, giving the teen more opportunity to engage in delinquent or antisocial behavior without being detected. Also, the teen has more opportunity to start to associate with other undesirable or antisocial teens without the family's knowledge. And this will worsen the likelihood that the teen will engage in further antisocial behavior and drug use. Another predictor of delinquency is, as I've said, affiliating with other deviant peers, including gang members. One predictor of delinquency, not as important as the others I've already mentioned, but still an influence, is low parental involvement in the family, where the parent themselves appears to not wish to be a parent and may spend inordinate amounts of time away from the family and refusing or simply ignoring their child care responsibilities. To some extent, the parent themselves may also have criminal or antisocial behavior or antisocial personality, which is ASP on my diagram here. And certainly, we see some parents having very poor management skills that they are using with their child or teen. In a few cases, we see that parents may have their own mental health or health problems that are interfering with their capacity to be a parent and to interact with the teen appropriately. Of course, families that live in very poor socioeconomic environments may also have teens more likely to engage in delinquency because of being exposed to other antisocial or criminal elements that often exist within such low social circumstances. Lastly, marital problems can contribute to delinquency. When parents are arguing with each other, this may interfere with their ability to care for, monitor, and manage their teens, and that can lead to increased antisocial behavior in the teen as well. These risk factors on my slide are listed in their descending order of influence or risk, with the ones at the top being most likely to contribute to delinquency or conduct disorder in a defiant teen, and the ones toward the bottom being much weaker or less likely to contribute to such delinquency. Defiance in teens, as well as in children, often arises from 4 factors. 2 of these are primary and are directly causal of the conflicts with parents, and 2 of them are background factors. I've already mentioned these, but it will help to diagram them briefly so that you can see them graphically and how they interact with each other. The first is the teen's own emotional dysregulation, negative temperament, and maybe even psychopathology. That is, the teen has another psychiatric disorder. A second factor I've already mentioned is that the parent may also be more emotional, have more negative temperament or personality, perhaps even also have psychiatric disorders or psychopathology, particularly ADHD, depression, or antisocial personality disorder, along with substance use disorders. Finally, a third factor is, as I've mentioned, the ineffective management methods being used by parents with the teen. And that is that the parent is often very inconsistent in using consequences or even setting up schedules and routines within the family, is often indiscriminate themselves in when they use emotion, when they're angry, when they give rewards or punishments to the teen. This is often unpredictable, inconsistent, and sometimes harsh and extreme. There is an excessive reliance in these families on not just talking and arguing, but yelling and screaming and the use of high levels of negative or hostile emotion with other family members, and particularly with the teen. And of course, the teen is going to give back as good as they get, as we say in English, which simply means that the teen will reciprocate in using these negative emotions. Finally, I often see a pattern of immature parenting that we call tit for tat, which is that the parent acts like the teen. So if the teen yells, the parent yells back. If the teen swears or uses obscenities in an argument, then so does the parent. If the teen should defy or refuse the parent does the same thing back. And if the teen should touch, push, or engage in aggression toward the parent reciprocates with their own form of aggression. This is a very immature pattern of behavior in which parents are responding with emotion and poor impulse control rather than parenting the teen from a set of reasonable, rational principles for how to engage in cooperative problem-solving behavior with the teen. Also, in many cases, there are background events within the family that may further contribute to both the disrupted parenting by the parents and the negative moods in both the parent and teen. These can be stress events, economic events such as low income or poor socioeconomic status. They can also be marital difficulties and other things that I've already mentioned. So let's diagram these four factors. The defiant teen's behavior is represented as you see here on the right side of the slide, and we've divided it into its two dimensions, the emotional dimension and the social defiant dimension. Where do these arise from? As I've said, one contributing factor, especially to the emotional component, is that the teen has an emotional disorder, a psychiatric disorder of some kind. The most common is ADHD, but it could also be a mood disorder like bipolar disorder, or disruptive mood dysregulation disorder, or just generally an irritable, negative temperament and personality. But all of this is to say that there is something inherently disrupted in the teen's ability to manage their emotions once they are provoked. Now, if the teen has ADHD and particularly has higher rates of hyperactive and impulsive behavior, that can contribute a little bit to the social component of defiant behavior, obviously because it can be very difficult to parent a highly active, restless, fidgeting, distractible, and impulsive teenager, and those traits alone could lead to conflict between parent and teen. But by far the biggest contributor to the social component of defiance in teenagers is disrupted parenting. That is a pattern of emotional coercion by the parent and not just by the teen. As I've mentioned, this disrupted parenting is often consistent or consists of inconsistent and indiscriminate use of consequences, anger, emotion, or mood, overreacting to even trivial behavior by the teen, and then sometimes not reacting at all to very offensive behavior or disruptive behavior by the teen. So there is a vacillation back and forth between being overly controlling and not being sufficiently controlling of the teen, sometimes to the point where the parent is even shy or timid about disciplining the teen at all. This can happen in situations where the teen has learned that not just emotional behavior, but violent and aggressive behavior are means to get parents to back off and let them do as they wish, and that leads to, of course, a certain reluctance on the part of parents to engage the teen who has become defiant, violent, or aggressive. Those are the two main factors that are leading to defiant behavior in the teen. But as I listed on the previous slide, two other background factors can also contribute indirectly to disrupted parenting. One is that the parent is also having psychological or emotional problems, or is experiencing high levels of stress, perhaps from employment difficulties or marital difficulties or their own depression and substance use problems. Another factor that can contribute to disruption of the family and disrupted parenting are background factors in the family and the community that you see listed here, such as family isolation, living in a poor neighborhood that may have higher rates of poverty and crime, experiencing marital conflict and divorce, and so on. So these two factors are background events, but they can worsen the parent's own management of the teen, and that, of course, then leads to greater conflict with the teen as well. And certainly all of these factors can begin to interact with each other if they are persistent over time. So that the teen's defiant behavior can actually worsen the parent's own psychological adjustment, mood problems, and so on, including leading to low sense of parental competence in the parenting role and low self-esteem or even depression. And should those already be there, parent-teen conflict and defiant teen behavior can make them worse. And of course, if the teen becomes sufficiently defiant that they developed conduct disorder and antisocial behavior within the community, that can feed back to worsen the community itself. And so you see a cycling here among these factors. But again, the two that are primary are the teen's difficulties with their own emotion regulation and psychiatric disorder, and the parent's difficulties with teen management and employing disruptive, emotionally coercive parenting. Let's take a closer look at this disrupted parenting factor, what we call emotional coercion. Now, both parent and teen are learning to use high levels of negative emotion to manipulate other people to do what they want them to do. The principal motivation for the teen to use this emotional coercion, as I've said, is to get out of doing things they do not wish to do. That is, to get parents to back off, leave them alone, withdraw their demands and rules and requests, and let the teen do as they wish. We refer to this as negative reinforcement because it's not designed to get attention or to get positive consequences from the parent. That might be true of a very young preschool child who may throw a temper tantrum to get parental attention, or perhaps to get some kind of treat or toy when they're in a store out shopping with their parent. But this level of defiance in teens is usually not of that sort. It is not intended or designed to get positive consequences. It is instead intended to get people to withdraw. That kind of consequence is referred to as negative reinforcement, because when we get out of or escape from things we find aversive, unpleasant, or unwanted, that is reinforcing to us, and it will strengthen that pattern of emotionally coercive behavior. So the teen is doing this, but so is the parent. The parent is beginning to learn, not intentionally, but the learning occurs nonetheless, that they too can get their way with the teen through using high rates of emotion, anger, and aggression. Now, each person, the parent and the teen, is coming to learn that the use of strong negative emotion against another person sometimes wins the interaction, gets the other person to do what you want them to do. Other times, it doesn't work. It doesn't succeed. We refer to this as a partial reward or reinforcement event or schedule. It's very much like gambling or playing slot machines. You may win periodically, and you may win often enough that you will keep putting money into the slot machine even when you lose, because there is always the chance that you may win on the next encounter. Psychologists know that the pattern of consequences that leads to the strongest and most consistent pattern of behavior is just this: a partial reward schedule in which sometimes you win and sometimes you don't. And that will strengthen that emotional behavior so that it occurs every time. Just as the gambler puts coins in the slot machine every time and pulls the lever or pushes the button, even though they may win only 1 out of every 5 or 10 times. They keep playing the game. They keep gambling. The same is true with parents and teens in these families. They don't have to win each encounter in order to use emotional behavior in every encounter, because they never know whether this will be the interaction in which the use of negative emotions wins for them, gets them their way. Now, this pattern, over time, escalates more and more rapidly, because each person is learning that in order to win, the previous, perhaps low levels of negative emotion aren't working anymore. So they escalate the emotion to more anger, hostility, even aggression or violence, and then it wins. So what each person, the teen and the parent, learns is that the faster I escalate to more negative emotional behavior, the greater the odds I'll win this encounter and get my way. But each person has learned this, so each person keeps acting this way, escalating more and more toward higher levels of conflict, of emotion, and even of violence in an effort to get the other person to give in. Now, I want to emphasize that this pattern of behavior is not intentional. It's not being learned because someone sat down and chose to learn this. But the learning occurs nonetheless through the process of the interactions occurring frequently each day. And that is what's leading to what we call this coercive family process, or emotionally coercive interaction patterns. And it goes both ways. And it might look like this. The parent makes a request or a command of the teen. The teen ignores the parent's request. The parent repeats it again. The teen may ignore that or show some low level of dislike, a smirk or rolling their eyes or averting their gaze from the parent. The parent may repeat the command again. And again, the teen simply doesn't comply, or may even begin to become emotional, or verbally refuse to do what the parent's asking, or simply beg for more time. I'm almost done with my video game. I'll do that when I'm done. But with each repetition of the command, the parent's anger is escalating. and so is the teens. So that eventually these two people are now engaged in an argument rather than a calm, reasonable request or interaction. At some point, this argument proceeds to the point where threats start to be exchanged. The parent starts to threaten punishment, perhaps removal of a privilege, or perhaps even physical violence. The teen may escalate to verbal and physical protesting, and the argument simply escalates even further. At some point, this interaction has to end because it's emotionally exhausting. And it may end with either the parent withdrawing from the interaction, and of course the request or the task goes uncompleted, or the parent may engage in violence toward the teen in order to gain the teen's compliance, even if that requires aggression. The teen may also show a similar pattern where sometimes they give in order to get the parent to not engage in the violent or punitive behavior. But the teen may also counter as well with violence of their own. So it's hard to predict, excuse me, the outcome of each of these interactions when they occur. They escalate quickly. They're very emotional, often have high rates of verbal conflict, and may eventually lead to physical confrontations between parent and teen as well. This, of course, is a very serious problem that needs immediate treatment attention. This slide simply describes in English, in language, what the last diagram represented, so I won't spend much time on it here. What does all of this mean for treatment for this family? Excuse me for just a moment. First, for the parent, it means that we have got to work with them on reducing their inconsistent use of both positive and negative consequences, their vacillation from lax and timid to harsh and extreme, to become a more reasoned, consistent parent, not just in the use of their consequences, but in the family's routine more generally, the sequence of activities across the usual weekday or weekend day. Next, we need to decrease the parent's reliance on emotion, on yelling and screaming and threatening, and to increase the parent's use of both positive reinforcement, such as approval, recognition, positive consequences, and rewards for when the teen is compliant, so that we can strengthen that behavior pattern in the teen. But also we need to have the parents prevent the teen from escaping the demands that the parent has made, because after all, the escape from the unwanted task by the teen is partly what is reinforcing the teen's hostile and defiant behavior. So we have to show the teen that it doesn't matter what they do, they will still have to do this chore, task, or obey this rule that the parents have imposed on them. We do this through teaching parents to implement mild but very quick, very swift punishment or discipline immediately upon the first occurrence of defiance. Not 30 minutes later at the end of a highly emotional argument, but within 10 to 15 seconds of the first act of defiance or noncompliance. Swift justice. It can be mild, but if it is done quickly and consistently, it means that the parent has credibility. That is, that the teen knows that each time the parent is going to act very quickly in order to punish defiant behavior. But the teen is also learning that the parent is also likely to act very quickly with the use of praise, approval, and positive consequences as soon as the teen is compliant with the various tasks and activities. Because you see, sometimes in these families, what we see is that the teen gets nothing for doing what they're supposed to be doing, for obeying rules, for doing chores, for completing tasks and instructions that they're given. Because they're expected to be this way, nothing happens when they do it. But this leads to very weak compliant behavior because there are no positive consequences that strengthen it and that show the teen that this is what we desire from them. So we have to make sure that we increase positive consequences immediately upon the occurrence of compliant teen behavior, at the same time that we are going to institute swift and immediate, although mild, forms of punishment when the teen disobeys. Both of those have to go together to change this pattern of family conflict. In addition to that, we believe that parents have to be encouraged to monitor their teens' behavior much more often than they may have been doing. And we do this for several reasons. One is to make sure that parents know who their teen is hanging around with when they are outside the family in the community. Are they socializing with pro-social, acceptable peers who model good behavior? Or are they drifting toward other delinquents, antisocial people, who are going to encourage more antisocial behavior in them and possibly even drug experimentation or drug use? So parental monitoring first serves the purpose of knowing what teens are doing and trying to steer them away from inappropriate activities. The second reason for monitoring is to catch the teen being good, so that when the teen is engaged in some activity and they're not disruptive, they're not emotional, they're being very appropriate, maybe even they're complying with the task we've asked them to do, parents need to be there and catch that behavior when it happens, using positive reinforcement, that is approval, recognition, and rewards immediately for when they detect positive behavior. We have to stop ignoring the positive behavior the teen may be showing because we expected it, and instead begin to reinforce it through the use of positive consequences. Now, we also have to teach parents and teens strategies for problem solving and for talking to each other using positive communication skills that facilitate problem solving, rather than using yelling, threats, hostility, and other negative communication patterns. There will always be some disagreement between parents and teens. That's a natural part of teens growing up and wanting to have a say in their lives. But how we deal with that teen's disagreement is what we're talking about here. There are appropriate ways of negotiating disagreements using problem-solving strategies and positive communication that can be successful for all parties to the problem. Sometimes parents, like teens, also have what we call unreasonable or irrational beliefs about each other, expectations of what the other person should be doing. And so sometimes the goal of treatment is, in addition to everything else here, trying to identify these cognitive or psychological biases and beliefs that are not appropriate for the parent or the teen in this circumstance. Now, we're also going to do this with the teen as well. That is, we're going to work with the teen and the parent on problem solving, positive communication, and changing unreasonable beliefs. Now, when defiance has lasted so long that the person, the child, is now a defiant teen, as I've said, this often means there is another psychiatric or psychological disorder present, and that may require other medical or psychiatric management of the disorder, such as through the use of medications to deal with ADHD, depression, bipolar disorder, or disruptive mood dysregulation disorder if they are present. So it isn't just going to be family therapy that uses problem solving and communication training, as well as teaching parents better child and teen management skills. We may also be adding in psychiatric medications as part of the treatment plan. Now understand that these medications won't work if the psychiatric disorder they're designed to treat isn't present. That is, they won't work to reduce conflict and defiance when there is no emotional problem there for the medication to treat. For instance, ADHD medicines will reduce defiant behavior in an ADHD child because it helps to lower the emotional dysregulation and contain it when it's due to ADHD. But if ADHD is not there, giving an ADHD medicine to an otherwise defiant child or teen will not reduce the defiance because it isn't related to the ADHD and its emotional dysregulation. So I hope you understand the point I'm making here. These medicines, because they treat other psychiatric disorders like ADHD and help to control them, might also indirectly contribute to a reduction in defiant teen behavior, but only if the other disorder is there. Now, along with Arthur Robin, I have developed a program for defiant teens. There is a manual for professionals called Defiant Teens that contains all of the information the professional will need to conduct these sessions of family therapy. But along with my colleagues, Dr. Robin and Miss Benton, we have produced a trade book for parents called Your Defiant Teen that also explains how to do this program on your own. We encourage parents to try to do it on their own only where the teen's defiance is relatively mild or perhaps moderate in nature. But where the teen's defiance is beyond that, or where there is another psychiatric disorder present, it is better for the parents to engage a professional and to go through this Defiant Teen program with the professional under their guidance in order to get optimal benefits. So the goals of my program for teens is to first of all identify whether there are any other psychological or psychiatric disorders in the teen and parent and get those treated right away in order to reduce whatever contribution they're making to the family's conflict. The second thing that we wish to do is what we're doing here. We want to increase parental knowledge about oppositional defiant disorder, ODD, and of course conduct disorder, CD, when it happens. And that, of course, helps parents to understand why the teen has become so defiant. We also want to improve parent-teen conflict management through the various strategies I've already described on the previous slide, including not just using consequences more consistently and appropriately, but also learning problem-solving strategies, positive communication skills, and, if needed, changing unreasonable biases and beliefs that parents and teens may have. Our goal in doing all of this, of course, is that we hope to make the teen become more compliant, pro-social, well-adjusted, and open to being socialized and becoming independent. And in the long run, that should improve the teen's prognosis. We also, of course, want to reduce parent-teen conflict in order to improve the family environment and make it more peaceful, if not loving. The optimal participants for going through my Defiant Teens program is where we have a teen who has oppositional defiant disorder, usually along with other disorders, and the teen is between 14 and 19 years of age. If the teen is younger than that, in other words, if this is a child between 2 and 12 years of age, I will refer you back to my program, Your Defiant Child, and the professional manual, Defiant Children, that goes with that for professional implementation of the program. So, children between 2 and 12, please use the Defiant Child program. For teens 13 or 14 and older, this program, Defiant Teens, is more appropriate for them. We of course expect that the teen has a consistent parent or caregiver, otherwise there's no one for us to train to help the teenager. We screen out teens who are moderately to severely psychotic, schizophrenic, or on the autism spectrum, because this program relies a great deal on language, communication, and problem solving, and often people with these disorders are not going to be open to or available for that kind of very heavily language-based training. The same applies with teens who may be intellectually disabled, such as having an IQ or intelligence quotient below 50 or 60 or even 70. It's difficult to train someone whose intellectual development is so limited. Finally, we do not like to take people into this program where the teen has already learned that aggression and violence toward a parent is a successful strategy for getting their way. And that's because such violence will likely escalate further when we try to set limits on the teen and require that they perform the tasks or obey the rules that have been requested of them. Similarly, we don't take parents through this program if they have a serious psychiatric disorder, such as schizophrenia, for instance, or psychosis, or a serious drug use disorder that needs to be treated first. The most successful families who go through this program are likely to be those in which the degree of parental impairment is less, the degree of social isolation of the family is less, and there are little, if any, health or psychological difficulties in the parent. Parents who are reasonable intelligence and of typical levels of education can easily go through these programs. Parents who are having marital problems should have those problems addressed first before going through the Defiant Teen program. We need parents to be cooperating with each other in order to institute this program consistently with the teen. We can't have parents playing against each other, using the teen's problems against each other as part of their marital conflict. And as I've said, seriously violent teens should not go through this program. Now notice that the success of this program declines with age. The older the teen becomes, the less likely they are to respond. Overall, about 25 to 35% of the parents that go through this program are likely to see very good success with the program. You might be wondering why that figure isn't higher. For several reasons. First of all, I would wish to point out that the success rate of any other type of family therapy for addressing a defiant teen's problems is only about 5 to 10%. So our program is at least 3 to 7 times more effective than traditional forms of family therapy. Another reason for the more limited success rate is that the younger the child, the easier it is to change their behavior because there has been a lot less learning, a lot less years of opportunities to learn that emotional coercion. So for instance, my program Defiant Children has about a 75% success rate of helping young defiant children become more controllable and manageable and compliant. But the older the defiant child is, the more training they've had, the longer their defiance has gone on untreated, the more solidified and persistent it has become. And that makes it much, much harder to change. Another reason is that the teen, unlike the child, is no longer under the complete influence of the parents as the primary source of influence or control over their behavior. In young children, it is largely the parents who are managing the child. But when we get to adolescence, the teen is spending more and more time away from home, away from the parents, with other teens, other adults, and generally out in the community independently of others. So there's less parental influence, less opportunity for parents to manage and control the teen. And of course, along with this greater independence and greater exposure to other sources of influence, the teen is developing a psychological sense of independence, of self-governance, so that they want a say in what happens to them, whereas a younger child will not yet have that sense of independence or self-governance and be more compliant and pliable to the training by the parent. So there are various reasons, including the fact that the longer defiance has gone on, the more there is another psychiatric disorder present with defiance in a teen. And that's going to contribute to the persistence of defiance and the more limited success of this program. So for various reasons, waiting until someone is a teen in order to deal with their defiance is going to reduce the success of any psychological intervention in helping that teen. Sometimes to the point where the teen may need medication, may need placement in a psychiatric facility, or may eventually leave home and become independent of their parents earlier than other teens do, perhaps even running away from home. There are a number of general principles in our Defiant Teen program that we will teach to parents. First, the use, as I've said, of immediate, frequent, and contingent positive consequences whenever the teen is positive, well-behaved, obedient, or compliant, or simply not disruptive. Parents need to be using high rates of consistent consequences. Sometimes these consequences also have to be negative or punitive, and again I've mentioned, these too must be predictable, swift, immediate, and consistent. So positive and negative consequences need to be utilized often and consistently and immediately in these families as part of the training. We also want parents to manage their teen from a set of rules and principles and to stop engaging in emotional parenting in which they are acting as bad as the adolescent when it comes to yelling, screaming, arguments, and emotional loss of control. We call this management from the head or from principles and not from the gut or from emotion. We are going to teach parents not to talk so much, to act and stop yakking, stop nattering, nagging, talking, reminding. Continued arguing with a teen does not represent a successful strategy for problem solving and for reducing conflict. But actions do. And that's what we mean by using swift consequences. We also teach parents and teens, but especially parents, that we want them to use rewards before they punish. They're already doing a lot of punishment, and it's not working very well with the teen. And the reason it's not working very well is, number one, there's very little reinforcement and reward in the family for doing the right thing that the teen does, and therefore the teen's behavior is on what we call extinction. Positive behavior is not being supported by positive consequences. So for punishment to work, the first thing we have to do is increase the available rewards for appropriate behavior. And then we can selectively use mild but swift punishment when defiance or conflict occurs. So Start with rewards first, not with punishments. As I've said, talk less, but touch more. When you have something to say to the teen, you go to them, you put your arm around them or touch them on the shoulder or on their arm. You get their attention by having them look at you, and then you say quietly but firmly what you want to say, whether it's a command or a request, or it's disapproval, or even approval. It needs to be personal, with eye contact, in a firm, credible, genuine voice. And then it works. As opposed to yelling, screaming, arguing, yelling upstairs or across a room or out of doors, and talk, talk, talk. It isn't going to work. We want parents to get more proactive, anticipating the problems that a teen will have ahead of time and trying to head them off by having a plan in mind. We've talked about increasing teen monitoring of the teen's activities by the parents, and then of course teaching parents that how they act is serving to model good or bad behavior for how the teen is supposed to act. And that goes back to my third principle above. Act reasonably from a set of mature principles and not emotionally like an unregulated young person. Be mindful of which one of you is the adult here. A teen is not an adult and cannot be expected to act the way adults should in cooperative, problem-solving, conflict-reducing interactions, but a parent can. In our program, we are going to teach parents about oppositional disorder and why teens misbehave. We're going to work with parents on improving their use of attention, approval, praise, and recognition frequently upon the occurrence, immediately, of prosocial, positive, and compliant behavior. We're also going to teach them to use praise and approval when they make requests of their teen, when the teen becomes initially, at first, compliant with the request. We may have to set up stronger reward programs, such as point systems, where the teen is going to earn points, like money, for the things that they do, and then can spend their points, like money, obtaining the privileges they want from the parent that the parent controls, such as money or an allowance, getting electronic privileges with games or with technology like computers, tablets, smartphones, and getting access to them, even getting the cell phone or Wi-Fi plans that support these kinds of smart technology. All of that costs money. Usually the parent is paying for it. We believe that teens need to earn these privileges, that is, access to these electronic devices, through their behavior with their parents and family, and not simply be given these privileges as if they were birthrights. So we're going to link up the privileges the teen wants with a point system for doing what parents ask you to do. And that will require setting up like a bank book in which the privileges are listed and their costs, in which the chores or tasks are listed and how much the teen can earn for doing each of them, so that in one place there is a chart that shows the menu of here are your responsibilities, here are the privileges you can earn, this is how many points you'll get for doing things, and how much you have to spend to get those privileges. And then, of course, teaching parents about using appropriate forms of punishment other than violence. Loss of privileges, such as taking away electronic privileges, as I've mentioned, isolating the teen to their bedroom in order to help them recover emotionally and also perhaps serve a brief time-out period, and if necessary, teaching parents to ground the teen, that is, restrict the teen to the home without opportunity to leave the house until the parents say that they can. In English, we refer to this as grounding. You might refer to it as house arrest, but basically the teen is restricted to the home as part of the punishment. Now, if grounding is to be used, it should be no more than a few hours to 1 or 2 days. We do not require restriction to the home for days or weeks at a time because it will lose its effectiveness. It is grounding for only short periods of time, usually during the teen's leisure time activities. And then, of course, we can concentrate on improving school behavior through the use of a daily behavior report card. Most importantly, unlike my program for defiant children, which also teaches exactly the same things on that last slide, on this slide, I'll show you what we teach to parents of teens. First, we teach parents and teens the 6 steps to problem solving, and we have them use these 6 steps to discuss one conflict at a time, one problem, and stay on that problem. As part of this, we are also going to teach both parents and teens positive communication skills, how to talk to each other in a reasonable, unemotional voice, to sit up straight, to make eye contact, to treat the other person with respect. So we have to work on both parents and teens using positive communication instead of the negative communication and high rates of emotion they have gotten used to using with each other, which are very negative communication patterns and will shut down problem solving as soon as they occur. Lastly, as I've said, we do try for some families where they're present to identify unreasonable beliefs that they have about each other and change those to more appropriate beliefs. The 6 steps to problem solving are seen here. We start by teaching these in our initial sessions. We have a chart that lists these 6 steps, and the parents and the teen are requested to choose one problem, one disagreement, and then to follow these steps to solve it. We like the family to start with a very minor problem, not one that is loaded with lots of conflict and anger, but a relatively minor disagreement that we have a very good chance of solving with this approach. We want them to have success at the beginning. If you tackle your hardest problems, the hottest arguments, the most difficult topics, you will fail. And therefore you won't do this anymore. So start with more mild, reasonable problems to solve. Number 1, identify and define the problem and write it down on a sheet of paper. Number 2, each member of the family is asked to brainstorm multiple possible solutions to the problem, right? And write them down. No criticism, no anger, no hostility, just creativity. Think of anything that you can think of that might help solve this problem. Even if it is bizarre or silly, write it down. Next, each person goes through the list and says what they think about each solution. So this is to be brief. It can even be just, I like it, I don't like it, I could live with it, and then move on. Eventually, as we go through that list, we're going to find 1 or 2 options that everybody could agree. Maybe they don't like it, but they could agree to it. We're then going to choose that most agreeable option. We're going to circle it, and we're going to try to institute that plan for 1 week. We're also going to build in positive consequences for the teen for doing it and negative consequences for violating it. So we want to make sure that, as we say, there are teeth in the contract. There are consequences for both teen and parent if necessary. It's only an experiment. We're just going to try it for a week and see how it goes. And then a week later, the parent and teen can sit down and review. How's it going? Do we need to adjust it? Would another option have been better? And then go on for another week doing that. So we're going to turn this into a contract. And each person in the family, the parents and the teen, are going to sign the contract. And we're going to post the contract in a visible place in the home so that all can refer to it to remember what we are trying to do this week. The next week, as I've said, we'll reevaluate and change the solution if necessary. After doing that for, say, 3 or 4 different problems, we then begin to work with families on positive communication. I've already described these, teaching them how to sit up straight, look at the other person, be specific when you express an opinion. Don't use anger, obscenities, or emotional tones of voice. You can disagree calmly with somebody by saying, I simply don't agree with that, rather than yelling at them. Accept responsibility for your own actions and opinions. Stop blaming others around you for your problems, and instead take personal responsibility for them. We teach parents and teens that when someone says something, before you talk, paraphrase what they've just said to show that you heard them, that you respect them, that you understand where they are before you try to explain your opinion. There needs to be a give and take in the conversation, rather than one person dominating the interaction most of the time. Give everyone a chance to talk and encourage them to participate if they seem reluctant to do so. And of course, avoid the use of insults, what we call put-downs, obscenities, sarcasm, ultimatums, and body language or facial language that conveys contempt or disrespect or even just disinterest to the other person. If necessary, we may encourage the parents and the teen to stop for a moment if things are getting emotional and take a break. Get a drink or a beverage. Maybe just count to 10. And then, if necessary, go for a brief walk around the home and come back and sit down and re-engage the conversation once you've had a chance to recover emotionally. Finally, we teach parents and teens that some parents have very unreasonable beliefs about their teen, such as teens should always obey a parent, no matter what. That just doesn't happen on this planet, so don't expect teens to agree with everything you're asking them to do. The important thing is not that they disagree with you. The important thing is learning and showing them how to negotiate a disagreement so that all parties feel that they can cooperate with it. That's the problem solving with the positive communication. But where we find that parents think that teens should always obey or get out, that's an irrational belief, and we need to work on the parent changing that. The teen could also have these hidden or unreasonable assumptions about their parents, such as if my parents don't give me my way, they don't love me. Or my social life will be completely ruined if I'm not allowed to do this or to have that piece of clothing or smartphone or be allowed to go out and hang out with my friends at the shopping center. These are irrational beliefs. Of course, your parents love you even when they do have to put restrictions on you. Indeed, by putting limits on you, it shows that they care about you. If they didn't care about you, they'd let you go do whatever you wanted to do. And that, of course, makes no sense. So, as I've said, there are various kinds of unreasonable beliefs. Beliefs that parents can have that you see here, such as perfectionism, complete obedience, such as ruination. If I let my teen have even any independence from our home, she's going to come back a pregnant, drug-addicted whore. So this kind of projection to ruin that isn't there. Parents can also have the belief of malicious intent. My teen is doing this just to make me angry, which of course isn't true. Right? Parents also can have an irrational belief that a teen should appreciate and say so for everything I do for them. Well, teens just don't do that, right? And to expect that is to expect too much, right? And of course, indulgence. The best way to show love to a teen is to buy them whatever they want. The teens also have irrational or unreasonable beliefs that I've already mentioned, such as ruination, or the need for complete autonomy, or if you loved me, you would give me access to everything I asked for. And the teens sometimes believe that parents should appreciate everything that they say and do, otherwise their parents don't like them. So sometimes we sense that these beliefs are in the background, and we try to identify them explicitly and get parents and teens to work on them. In conclusion, I hope that you've learned that teen defiant behavior and parent-teen conflict can arise from multiple sources or causes. But the two most important are that the teen may have a psychological disorder that is causing emotional dysregulation, so can the parent, by the way, and that the parents are using a very ineffective form of parenting, which we call emotional coercion, in order to deal with the teen. Instead, problem solving and communication skills need to be substituted for disrupted parenting. So, family training can be beneficial for many families in teaching them this kind of problem solving, behavior management, and communication training. But oftentimes, because defiant teens often have psychiatric or psychological problems, we may also need to employ medication in the management of the teen to help control that coexisting psychiatric disorder and make them more amenable to training in handling parent and teen conflict. In most severe cases, we may have to place the teen in an inpatient unit or at a residential school in order to get more control over the teen's highly defiant and delinquent behavior. But that is not very common. I hope you've learned something in this program today. Thank you for joining me for this lecture. Good day.